Welcome, everyone. Thank you for joining us for the 6th Annual Dahdaleh Graduate Scholars Symposium. My name is Mary Viktorovich, and I'm the Director of the Dahdaleh Institute for Global Health Research. Today, we're delighted to present 4 accomplished graduate students. They'll each be giving a presentation about the progress of their funded research projects and providing other insights about their research. And as is our usual practice, I'd like to begin by acknowledging the Indigenous land on which we are residing. And as it's a hybrid event and some of us are in different territories, please take time to give thanks and respect for the land on which you're currently living and working. Today, we're here on the York University campus in Toronto, which is on the traditional territorial area known as Toronto. And we acknowledge its current treaty holders, the Mississaugas of the Credit First Nation. We also acknowledge this as a traditional territory of many Indigenous nations, including the Anishinaabe, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. This territory is subject to the Dishwa-Swan-Spoon-Walkenville Covenant, an agreement to peaceably share and care for the Great Lakes region. And this is just the first steps in our process of reconciliation, and many more steps to come. So we have an exciting lineup today, but before I introduce the speakers, I'd like to take a moment to recognize the contributions of all the Dahdaleh graduate students, including those who couldn't join today. The symposium aims to showcase all the hard work all the grad students put forth to further the field, notably in the 3 themes of our institute: planetary health, global health and humanitarianism, and global health foresighting. Thank you for all your contributions and for another wonderful academic year. So this is a 90-minute event that will end at about 12:45. We'll start with the 4 presentations, followed by a 20-minute Q&A and discussion, and we'll wrap up around 12:40. So a few gentle reminders for our guests joining us online. Please note that the symposium will be recorded. Please mute your microphones unless you're presenting or asking or answering a question. But do note that we will take comments and questions after all the presentations. So on that note, let's begin with a brief introduction to our first speaker. So Tareq Khalaf. Tareq is a PhD student in the Faculty of Health. He's interested in primary healthcare, interprofessional collaboration, autism, social prescribing, and healthcare quality improvement. So over to you, Tareq.
Thank you, Prof. Mary, for this wonderful introduction. Hi, everyone, and good morning to all of you, to those who are attending in person and those who are attending online as well. It's my pleasure and honor to be with you today, once again, as a presenter to share my research progress and updates. And we have good news as well at the end of the presentation, sharing the proposal and one expected paper as well. So let me just introduce myself. My name is Tareq. I'm a PhD student in health. My stream actually is health systems management and health data analytics. And my research actually is, and the interest of the research is all about autism because of my previous professional background, as well as a personal story of a family member being a caregiver as well. Could you just... Yeah, exactly. So let me just remind myself and everybody about autism. Autism is well known that it's a complex condition where there are many variations, including impairments and verbal, nonverbal, mental, and social development. Now, here in Canada, we have 1 in 50 people have youth who are aged between 1 to 17 years are on the spectrum, and the caregivers who are actually facing tremendous challenges when navigating the discrete system, from education, healthcare, any support for their kids. Now, we know that for the public, general public here in Canada, it's very limited resources in terms of healthcare. So you can imagine the additional limited access for the caregivers of children on the spectrum to get all these resources needed to support their children. Now, the parents, not only the caregivers for their children, they are caregivers, they are physicians, they are as well as they are the therapist, they are financial supporter, and they are playing multiple roles inside the family. And caregivers, not only parents, because for caregivers can be a sibling, can be next of kin, can be a grandfather, etc. So it can be expanded, and everyone is having unexpected hardship, mental, physical, social, psychological, and financial hardship because of the extracurricular activities, special education, and the caregiving cost for the children. Now, why it's global? If we are talking about autism itself, now in 2021, WHO said that we have 1 in 127 person had autism worldwide, and they mentioned that in low and middle income countries this percentage can be even higher because it's underestimated, underdiagnosed. So we can't rely exactly on this figure. It might be even higher than this percentage. So here in Canada, where the immigration system has started hundreds of years ago, but it was like mainly Europeans immigration, we can witness that. We can witness that it's becoming more racialized communities coming to this country. So in 2021, according to Statistics Canada, almost 1 in 4 individuals here in Canada is a recent immigrant. Not an immigrant, is a recent immigrant. That means they have landed in the past 5 years only. So we can imagine the percentage of immigrant population. Not only this, the top 3 immigrants or racialized groups in Canada, they are mainly South Asians, almost like 77%, counting up to 2.6 millions. Chinese, about like 4.7%, counting for 1.7 million. Then the Black community, around 4.3%, or 1.5 million. So we can imagine the percentage of racialized population here, the immigrants, and we can consider the autism is not like just a global issue, but also a local issue here in Canada. So we can look at the matter from the point of having a global point of view in our local community here in Canada. So what I have done, my research proposal was about exploring programs supporting the health and well-being of family caregivers of individuals on the spectrum. So there are 2 objectives of my research. The first one was to explore those supporting programs. The second one, which is very important, is to assess the candidacy of such programs for social prescribing with a focus on caregivers' health and well-being. Now, I added here social prescribing. May I know if anybody has heard of social prescribing term? Okay. Anybody else? I see. Okay, so it's very good to explain what social prescribing is all about. It's an emerging intervention which has started almost like 20 years ago, mainly in the UK, but it's spread out to other countries like UK, Canada, Australia, and other countries as well. The social prescribing model is all about that healthcare provider is connecting an individual, not connecting a patient. They connect an individual to non-medical services through like a community organization or social group organization, etc., through a link worker. So the purpose of having social prescribing is to improve the overall wellness and health and social connectivity to the participants. Now it has many applications in different contexts, etc. But in our context, which is like caregivers of individuals on the spectrum, it has not been really studied in depth as we wanted. So what I've done, I have conducted a scoping review following Arxi and O'Malley's framework, analyzing almost articles from 2010 to 2025 from PubMed databases. The initial research resulted in 1,317 articles, which we filtered out, and we finalized only 11 articles on inclusion criteria, focusing on caregivers, has an intervention conducted in Canada, the US, UK, or Australia. Now, you may ask me why those countries only, right? So first of all, the social prescribing has been emerging in many countries and these countries are on the top list. Those countries have also immigration population and racialized population, which can be also relevant to us as well. So there are promising examples of non-medical initiatives and the programs which we found in the articles to support family caregivers of individuals on the spectrum. Now, I can summarize just like preliminary results and themes which I found in the articles. The first one has an interactive programs that we've got like some interactive sessions for those interventions, such as using music classes, mindful parenting, or supported groups to support the caregivers. Another one is to have the community support. So the facilitators were not only just like trainers, were actually members of the community, mostly with similar experience. So lived experience, those peers have supported their peers as well in those interventions. Additionally, as social prescribing is concerned, so they use also in these interventions non-medical support, focusing on non-medical interventions such as counseling, music classes, peer support, group support sessions as well to support the caregivers. Now, which I noted a good example of collaborative support as well, included integration with the primary care, especially in the UK, where social prescribing has been initiated over there. And we've got like peer facilitators have been trained by professionals as well. And we've got one example of medical professional whom we know personally here in Canada, in Toronto, who has been involved in the planning itself in the intervention, and he was supervising the intervention itself in that study. Additionally, I noticed that most of the studies were like on very short-term measurements of the outcomes, either like before plus immediately after the intervention, with one exception that one case studied the outcomes up to 30 months. And this is a very good example because we want to understand the long-term outcomes of social prescribing and such models to understand, the long-term outcomes of for the caregivers as well. So I noticed as well that the social connectivity for a couple of cases and the studies, where one study combined both caregivers and the children on the spectrum in the intervention as well, plus one study combined caregivers of neurotypical families along with caregivers of the children on the spectrum, which improved the social connectivity and the social bonds between both the groups. In terms of accessibility and equity, there were some certain concerns about it because one study noticed that participants were mainly of high socioeconomic status. And one study, or actually like a couple of studies were online or virtual form, which improved actually the reach, but excluded digitally marginalized groups in a certain community. Now, one study has implemented availability of interpreters, although English was the medium of the counseling, etc., but they involved interpreters to show cultural responsiveness as well in their study. In terms of outcome-oriented programs, they are mostly outcome-oriented programs in the studies. And also studies like, having a reduction in depression rate, enhanced mindful parenting, having improvement in empowerment of the participant, as well as having stronger parent-child bonds and community integration. Now, what the next steps will be for this research? Actually, once I complete the manuscript, I will be submitting for publication. But I have already one publication being accepted as a chapter in a book supported by Prof. Farah. And here I want to acknowledge the support from Dr. Farah. She's really supportive and a great mentor to me. One more thing that we have partnered with one community organization, which is a good news for my research, and the chairman of that community organization is a healthcare professional, and he's into it. And we have submitted this proposal to CIHR for hopefully getting more fund and approval from their side. But anyways, we are going, as agreed with this community organization, to go ahead with this study, because they have database of families of family caregivers of children on the spectrum, and hopefully we can start this proposal early May 2026. So. Thank you so much for listening to my research update. We have probably good news in the coming weeks. That's all for now, and I'm happy to take any question now or probably in the Q&A session. Now over to you, Prof. Mary.
Okay, thank you so much, Fem. That was really excellent. Okay, yes, and as we'll take questions at the very end, we'll move on to our second speaker, which is Joanne. Joanne Ong, who is a PhD candidate in the Faculty of Health and Global Health. Her research focuses on how women's political empowerment shapes health equity. Her methodological interests include social statistics and community-based participatory research. So, Joanne, you're online, and over to you when you're ready.
Thank you very much, Mary, and thank you, Teresa and Natalie, for setting up this event. So, hello, everyone. My name is Joanne, and I am a second-year doctoral student in global health. My PhD project examines why the gender gap in self-rated mental health varies so widely across countries. We know women, on average, report poorer mental health than men, but the size of this gap is not constant. Some countries show very large gender inequalities, while others show very small. This raises an important question. What explains these differences? To answer this, I take a cross-national comparative approach and focus on women's political empowerment, defined as the extent to which women enjoy civil liberties, can participate in civil society, and are represented in foreign politics. My project develops and tests theoretical rationales for why there might be a relationship between women's political empowerment and the gender gap in self-rated mental health, examining how the mental health gap differs across countries based on levels of women's political empowerment. So, first, let's start with the definition of self-rated mental health. Self-rated mental health is a single item measure commonly used in population health surveys and some social surveys. It asks people one straightforward question: in general, how's your mental health? With response ranging from poor, fair, very good, excellent. For example, it's featured in Canadian Community Health Survey, the U.S. Medical Expenditure Survey, and the cross-national survey, the Global Flourishing Study. Even though it's a simple measure, self-rated mental health is informative. Research shows it correlates with multi-item mental health skills. For example, it's a single question where its scores closely match scores on longer questionnaires that assess symptoms, stress, and functioning, like the Center for Epidemiological Studies, the progression scale. It's also strongly associated with self-rated health, chronic mental and physical conditions, psychiatric diagnoses, health service use, and service satisfaction. Studies also show that women and men use similar criteria when evaluating their mental health, which makes self-rated mental health a reliable tool for studying gender differences in mental health and tracking how gender differences might change, for example, in response to policy change. So, in other words, findings of gender differences in self-rated mental health are likely to be trustworthy and not simply the result of methodological issues like different reporting styles. So, regarding the association between gender and mental health, the empirical literature shows a consistent pattern across countries. Women tend to report lower mental well-being than men on measures including self-rated mental health, but also depression and psychological distress. This matters because poor self-rated mental health is related to lower life satisfaction, weaker sense of community and belonging, and also higher exposure to family violence, poor subjective physical health, and the presence of physical chronic conditions. So Importantly, self-rated mental health is a different dimension from mental illness, and it's more related to subjective well-being. So research shows that subjective well-being indicators are more strongly shaped by subjective social status than objective social status. This might mean that self-rated mental health reflects more than just symptoms, but that people take into account their daily stress and overall life circumstances. Two main explanations then explain how social conditions affect self-rated mental health. For example, the materials explanation focuses on lower income or education and how this leads to fewer resources and more constraints, which increases stress and reduces well-being, while the psychosocial explanation focuses on the social context people perceive themselves to be in and their sense of status in an unequal society. So this also includes the role of stressful life events like caregiving burdens, labor market inequalities, higher exposure to violence, and overall lower income. The theoretical models attempting to explain why women generally report poorer mental health than men often involve the role of stressful life events. Less work, however, considers how subjective social status matters and whether the association between subjective social status and self-rated mental health varies across gender. So different countries provide different degrees of access to employment rights, autonomy, political power, and in general valued social positions to women and men. And this shapes their ability to control life circumstances. For instance, welfare states structures shape the extent and impact of socioeconomic position on health through how the state supports families, care work, and income security. For example, welfare states provide varying degrees of support for families, care work, and income security. And although we might expect more generous welfare states to reduce disparities in self-rated mental health, the evidence is mixed. For example, in Nordic countries, despite relatively more generosity, sometimes they show larger gender gaps in subjective mental health. More research is needed on how the social effects of welfare state arrangements vary by gender, because comparative welfare state research focusing on health but not considering gender may mask differences in how women and men benefit or fail to benefit from the same welfare arrangements. Similarly, more gender equal societies do not always exhibit smaller mental health gaps. One explanation is the double burden, women taking on expanded public roles while still carrying most childcare and domestic responsibilities. This is hypothesized to underlie the empirical pattern whereby Sweden, for example, shows a larger female disadvantage in mental and subjective health than less gender equal societies. Measures like the gender empowerment measure is critiqued because it combines many unrelated indicators. The gender empowerment measure is a country-level gender empowerment measure on economic participation, political participation, and power over economic resources. So although it tells you how equal a society is, it doesn't tell you what components matter for health. To this end, I'm focusing on women's political empowerment, which measures specific dimensions. The component of women's choice reflects women's ability to make decisions and have meaningful rights of domestic movement, private property, freedom from forced labor, and access to justice. The agency component reflects women's rights and abilities to express themselves, organize, and take part in political issues, civil society organizations, and being represented among journalists. The political participation index represents women's representation in formal political positions. So this lets researchers test which aspect of women's political empowerment is driving health outcomes. The Women's Political Empowerment Index also has broad temporal and global coverage, enabling cross-national and longitudinal analysis. In relation to health, theoretically, women's choice, strengthened through women's civil liberties, increases women's access to and control over resources, opportunities, and their bodies. Second, increasing women's agency, defined as their ability to demand collective preferences and goals through diverse forms of civic participation, helps ensure that information about issues affecting their lives reaches decision makers and influences implementation. Third, theoretically, increasing women's descriptive presence in formal political positions may help ensure that women's needs amenable to policy intervention are carried out on the policy agenda. Most research, however, on women's political empowerment narrowly only focuses on women's political participation as political empowerment and only considers child health outcomes such as infant mortality and vaccination coverage. However, each of these dimensions may involve distinct resources, avenues of influence, and social constraints that are important for women's health. Particularly, no work has considered the role of women's political empowerment for women's mental health. So my proposed project asks, does women's political empowerment vary the gender gap in self-rated mental health cross-nationally? I aim to identify the regional or country-specific factors that shape women's political empowerment as a suitable strategy for improving women's mental health in their specific context. I also investigate the mechanism linking women's political empowerment to the gender gap in self-rated mental health. For instance, age might be important. Political engagement typically increases with age. In settings with low women's political empowerment, the mental health gap may widen among older adults who interact more directly with political institutions, while remaining smaller among younger people, for instance. Currently, I'm conducting a scoping review that maps how women's political empowerment has been defined, measured, and studied in relation to women's health and health equity. My review will focus on how women's political empowerment is conceptualized, which health outcomes are examined, what mechanisms are proposed, and which countries are included in the existing literature. In addition, I'm also developing a research partnership alongside my supervisor, Professor Carrie Wu, with the Rural Coordination Center of British Columbia and the Rural Doctors Network in Australia to explore how social accountability operates in rural health partnerships. So to conclude, I want to thank my supervisory committee for their continued guidance and encouragement, as well as the Dahdaleh Institute for its generous support, and as well as our health partners. So.
All right, and now our third speaker is, sorry. Oh, let's see. Okay, perfect. So Babatunde Odugbemi, and he's a second-year PhD student in the Faculty of Health, also the Global Health Program, and his PhD research aims to enhance global response to antimicrobial resistance using a One Health lens. So over to you. Yeah.
Okay. Thank you, Professor Mary. Good morning, everyone. So I will be giving my presentation using. Just a minute. There we go. All right, thank you. So thank you. I'll be giving my presentation using the following outline. I will give an introduction, touching on antimicrobial resistance as a global health problem. And then I will introduce the concept of One Health and of governance. I will state the objective and significance of my research project. And then I'll describe the next steps and give an acknowledgement. Broadly speaking, I seek to generate evidence to improve One Health antimicrobial resistance governance in high and low to middle income countries. Antimicrobial resistance, AMR, occurs when microorganisms, whether bacteria, viruses, fungi, or parasites, change over time and no longer respond to antimicrobial agents, be they antibiotics, antiviral agents, antifungal agents, or antiparasitic agents. Antimicrobial resistance poses a serious problem because it depletes the medication available for treating infectious disease. It also prolongs hospitalizations. It also leads to increased health expenditures. Antimicrobial resistance is a global problem affecting countries across geographical and income divides, although there are disparities by region. The global burden is on the rise. In 2021, there were 5 million deaths associated with antimicrobial resistance, and this number is expected to increase to 8 million deaths by 2050. So antimicrobials are used across human health, animal health, and plant health. And thus, it helps to have an approach which recognizes the interdependent linkages between this. And One Health is such an approach. One Health is defined as an integrated, unifying approach to balance and optimize the health of people, animals, and ecosystems. There are multiple sectors involved in One Health. There are multiple disciplines. And it is also important to take consideration of how the society interacts with these sectors and with these disciplines. So there are also multiple interests when talking about the various actors involved in antimicrobial resistance. And there are also multiple levels of decision making. And this complexity, the many sets of multiples, means that governance is sometimes a challenge. So governance defined as a wide range of steering and rulemaking related functions carried out by governments or decision makers as they seek to achieve national health policy objectives. And good governance of One Health AMR solutions requires communication, collaboration, coordination, and capacity building across the different sectors. To underscore the importance of this, Dr. Fukuda, former Assistant Director General and Special Representative on Antimicrobial Resistance at the World Health Organization, was quoted as saying, "Without urgent coordinated action by many stakeholders, the world is headed for a post-antibiotic era in which common infections and minor injuries, which have been treatable for decades, can once again kill." We don't want that, and I want to contribute to preventing that. Thus, the objective of my study is to conduct an analysis of One Health antimicrobial resistance governance and policy approaches and their alignment with domestic priorities and social contexts in high and low to middle income countries, using Canada and Nigeria as case studies. The research will involve fieldwork in Nigeria and will consist of a scoping literature review, key informant interviews, a systems analysis, and a comparative institutional analysis. And from this piece of work, I hope that the findings could potentially inform solutions to guide future One Health AMR policy development and implementation strategies in different global settings. Presently, I'm conducting a scoping review on accountability mechanisms for AMR. And next, in the coming year, I hope to complete the review, prepare an ethics application, and prepare for fieldwork in Nigeria. I would also attend systems thinking workshops here at the Dahdaleh Institute and externally to improve my capacity on using systems approaches for my work. I gratefully acknowledge the Dahdaleh Institute for Global Health Research for their financial support through a Dahdaleh Global Health Graduate Scholarship. And I also acknowledge my supervisor, Professor Mary Viktorovich, and my committee member, Professor Tara Penny, for the support they have given me. Thank you very much for listening.
Thank you so much. Great to have that overview and understand the importance of the topic. Okay, wonderful. Well, and now to our final speaker, who is Ana Carolina de Almeida Cardoso, and she's online. Ana is a PhD candidate in the Faculty of Environment and Urban Change. Her research interests lie at the intersections between coloniality, modernity, and nature, with particular focus on climate governance and politics, the Anthropocene, and decolonial futures. So thank you so much, Ana, and over to you.
Hi, thank you, Professor, and thank you, everyone, for the opportunity to talk about my research. I might speak a little fast because I'm in the 5th year, so there's a lot to talk about, but please feel free to interrupt me, and I'll try to keep it as brief as possible. I'll start by saying I'm based in Rio, where I'm from. So as Professor Mary suggested, I'd like to do a land acknowledgement that I am currently standing on the lands of the Tupinambá and Temiminó peoples. And yes, this is my research. Colonization of the Future at the United Nations is this presentation because I hope to focus a little bit more on the field work that I've been doing, but I'll contextualize the research first. Climate fall solutions and resistance on the ground. I have a law background kind of in another life, and then my master's was in international relations. And now I'm a PhD candidate at the Faculty of Environment and Urban Change in the Environmental Studies program. So the context of my research, of course, comes from the climate crisis and its relation to planetary health. As you know, to quote the Dahdaleh Institute, a healthy planet is indispensable to global health, and focusing here on the interdependency between humanity and so-called nature and how that's undeniable, but denying that interdependence is at the core of this crisis and our failed attempts to deal with it. I also approached the climate crisis through its systemic underpinnings, considering colonialism, capitalism, patriarchy, and all of those dynamics that help shape but are also reproduced by this crisis. And also part of my context more specifically about the United Nations negotiations on climate change. So coming from this premise that there's a failure, a continuous failure of international climate politics and policy. And here I'm only focusing on the UNFCCC, the United Nations Framework Convention on Climate Change. And from the 1992 original convention, from the Rio Earth Summit, its ultimate objective was set as the stabilization of greenhouse gas concentrations in the atmosphere at a level that would prevent dangerous anthropogenic interference with the climate system. And if we're all living in the same planet, we can all agree that that has already been violated as an agreement. And now in the current state that we're in negotiations, we're 10 years from the Paris Agreement, whose main mechanism are the nationally determined contributions. Sorry, the acronym is wrong there, NDCs. And it's already been considered that they are falling short by the 6th IPCC assessment report. There are many submissions still pending, even though the deadline for the last submission round was last February.
Like her internet may be shorting out.
Yes. Because also on the mobile phone also it's still
Actually,
yeah.
and it's paused for everybody. Oh, even us? Everybody, yeah. Oh, and she'll just take a second to come back. Oh, yeah, she just left.
I think the signal is weak today for some reason.
Hi.
Oh, wonderful.
Sorry, I don't know what happened. I tried to go to the next slide, and then the meeting was gone.
Yeah.
Maybe, Natalie, I think I'm going to have to ask you to pass the slide for me because I don't have the power anymore. Thank you. So one of the key concepts of my research is colonization of the future. I'm not going to go too into it. I'm going to try not to because I want to get to the fieldwork part. But so for me, the climate crisis is also a crisis of imaginary. It has this concept of colonization of the future has ontological and epistemological dimensions because of the universalization of this colonial modern mindset of development, of progress and growth that are always at the center of politics, of social structuring and organization in general. And at the core, there's this divide between humanity and nature, as I mentioned at the beginning. And this is what sets the scene for our societal and political organization that enables the climate crisis to happen in such a systemic way. But it also has practical and political dimensions, meaning that these political projects are at their core, at their foundation, projects of ontopolitical continuation. So these countries and peoples and powers that have been benefiting from these systems want to perpetuate them in time. And that's why I'm calling it colonization of the future. So the future as a territory that's under occupation, both with political projects that are very practical, very concrete, and in climate politics that translates to false solutions, so market mechanisms and techno fixes that have not been proved but still permeate all so-called solutions for the climate crisis. This imaginary kind of dimension as well of ontology of how we see the world, how we see ourselves as humans, how we see nature in opposition in a hierarchy, right? Yeah. So the consequence of this is that this colonization displaces and exterminates all other possibilities of how we imagine and how we build future lives for ourselves as societies. Next, please. And yes, this other concept is how this translates in the UNFCCC negotiations is through so-called false solutions. This is a concept that comes from the climate justice movement, from civil society actors and rights holders. And they are false because they are presented as solutions, but in fact, they actually maintain business as usual. So no emissions are actually reduced when you consider the net amount. That's why we hear a lot about net zero. That's why we hear a lot about carbon removal, geoengineering, ocean alkalinization, all of these technological alternatives, but also market-based mechanisms like carbon trading, carbon market offsets, nature-based solution offsets, and all of these other, now they're biodiversity offsets that have very, very promote further harm to people and the planet, and don't really tackle the systemic roots of the crisis and this divide between humanity and nature and this imaginary, right, ontological dimension. Next, please. So with my research specifically, I'm conducting an ethnographically inspired study of the climate futures that are present at the United Nations. I'm considering the UNFCCC and these sites of negotiations as a site of dispute for the future. And that has a twofold meaning. One, it's a dispute for which future is gonna, sorry, I'm only thinking of the word in Portuguese, but which one is going to trump, right, the others, or which one is going to become true, but also if there will be a future at all, because we're also dealing with kind of apocalyptic scenarios, at least in terms of imaginary, you know, like in the last few decades, we hear so much about the end of the world, and, you know, flying to Mars seems more feasible than actually reverting the climate crisis, which is insane. But so there is this twofold dimension, and at the core of my research, there's this will to decolonize, which means accounting for and reflecting on the past and present in order to configure future pathways to remove colonial and imperial powers in all their forms. So next, please. I want to talk quickly about some field experiences and methods that I'm using. I'm in the 5th year, as I mentioned. So I've been to 3 COPs so far and 2 SBs, which are the meetings of the subsidiary bodies of the UNFCCC that happen every year in June in Bonn in Germany, where it's the headquarters of the UN climate change offices. So I'm using participant observation in these meetings. I'm conducting interviews with key actors who participate actively in the negotiations. We're doing document analysis and, of course, bibliographical reviews and some conceptualization, as I mentioned. So next, please. Yeah, and in these meetings, there are many different COPs that exist, many different ways to engage. One of them is being part of plenaries and negotiations. These pictures are all mine from the past few years. And this one on the left is a plenary in Bonn, and this one on the right was a negotiation that I was in just last month in November in COP30. Next, please. And yeah, I've also been part of organizing, presenting on some side events with the Center for Indigenous Knowledges and Languages research team that I also work at, a project for Indigenous climate leadership. Next, please. Then, yeah, how you engage actively in negotiations is by being a part of a constituency, because you can either be a delegate of a party, so representing a state and negotiating on behalf of a government, or you can organize in one of the 9 constituencies for observer organizations, which is very limited participation. There's barely any room to speak, no votes, no power whatsoever in that sense. But it's the only way that as civil society and non-state actors, we can actively participate. So I've been participating of the Indigenous Caucus, not actively, but in support, because I'm not Indigenous, but I work with an Indigenous research team at Cycle. But more actively, I've been participating of the Women and Gender constituency. This picture on the left is our coordination meeting before COP30 in Belém. And then this picture on the right is I had the pleasure and the honor of giving the final statement at the closing plenary of COP30 on behalf of the Women and Gender constituency. Next, please. And so, yes, there are also actions and protests that we can be part of, and that many people manifest their rage, frustration, and real solutions and hopes and desires in these protests and actions. So one on the left was in Bonn in June of this year. And then this one on the right was the People's March for the Planet that happened just now in Belém. It was the first COP since 2021 where it was held in a country that we could protest on the streets, basically. The last 3 COPs, we could only do actions and protests inside the UN venue, which is very, very limited. You can't name any countries, you can't use any flags. There are many, you need authorization. And so this one was great demonstration of international solidarity and desire for a different world. And this banner that is showing here on the bottom is in Portuguese, but it says "Our future is not for sale." And it was 50,000 people who came to that march last November 15. Next, please. So yeah, sorry, I know I'm over time. Just to conclude, some preliminary findings. The mapping of positions is already a huge headache, because you can imagine here on the right, there are the kinds of badges that exist. So you need a badge to get into the United Nations venue, and different badges give different kinds of access. So you can go in as a party representative, so a government representative. You can go in as a United Nations observer, as an international government organization like the World Bank, for instance, as an NGO. And this is how York University participates. And I went this last COP with a York University badge, or you can go as media. And then you have different kinds of access and power in that sense. Next, please. So this is, and it's a lot, it's meant to be a lot. This is when the best organization that exists of the countries negotiating blocks under the UNFCCC. It's impossible to understand, but I wanted to bring it here just to show that, within these groups, it's already a circus, kind of so hard to understand different countries' positions. And countries have these negotiating blocks and groups that they're a part of. And sometimes the groups that a country is part of more than one group, and they contradict each other in their positions. So it's there are a lot of internal divisions as well. There's a clear North and South divide in all negotiation tracks of climate change. And yeah, I just wanted to bring this picture because it gives a good, I think, scary illustration of how hard it is to understand countries' positions. Next, please. And so these are the observer organization constituencies that exist. There are 9 constituencies that have formal recognition under the UNFCCC. So they have distinct sets of rights between them. There are indigenous peoples who are consider themselves not part of civil society because they are obviously sovereign nations that should have a seat at the table and should have voting voice, veto power, but don't. They are only recognized as equals as all of the other civil society organizations, like the researchers, farmers, trade unions, women and gender, children and youth, local governments, environmental NGOs, and business is also recognized constituency. And there are other groups that are now fighting to gain formal recognition, like persons with disabilities, Afro-descendants, and local communities are fighting to gain formal recognition, which means being able to speak in negotiations. Next, please. So the other core preliminary finding I have is the development and growth are at the center of all of these negotiations. And that seems to be the most prevalent narrative of the future that is present there, a future that's still predicated on progress, on growth, never-ending growth, and that still ignores the root causes of climate change, still ignores the finite nature of our planet. And it's operationalized, as I mentioned, by false solutions being present in all negotiation tracks. There is also currently a huge conflict of interest. At the UNFCCC, there isn't a policy for conflict of interest like there is at the World Health Organization, where tobacco companies, for instance, have very limited, if not impossible, way of participating in the negotiations. In climate change, there is no such policy. So there is a huge fight to ban fossil fuel lobbyists from COPs. Only at this last COP, it was estimated over 1,600 fossil fuel lobbyists were present. And that surpasses any single country delegation except for the host country of Brazil. And this on the right is a picture of the business pavilion at COP30. Next, please, and I'm almost done. So this begs a question, a reflection, a conclusion that I'll be focusing on in my analysis about possible versus impossible futures. What are the limits of the United Nations space? And how does it deal or reproduce the systemic underpinnings of the climate crisis? So negotiations are so fought for, disputed over, and it's so hard to find even common ground, even between governments, that there's barely any room for alternative visions, right, of futures that are not based on growth, progress, and never-ending development to come into these spaces. And so this is one of the first conclusions that I'm getting from these experiences. And yeah, it's still a work in progress, still have a bit to go, but it's one of the very first ones. And this picture on the right is a picture of the People's Plenary that has been happening for the past 3 years, I believe. That there's one day where the civil society groups are able to organize their own plenary, and just see how different it already looks from the other pictures that I showed. Here in this sense, in this picture, there's many different indigenous nations holding a sign about violence that one particular nation was facing. Next, please. Yeah, so this is it for now. I'm really sorry about going a lot over time. There was a lot to bring. Thank you for sticking with me. And yeah, this is a conclusion about how, civil society and rights holders and all of us have this duty and sense of responsibility when we're in that space of pushing the boundaries of what is possible and kind of trying to widen that realm of the possible open in negotiations. But although knowing that it's, we do that with lots of grains of salt, and we know that that space is very limited, but we also know that if we're not there, then it's going to be even worse, and no one's going to be pushing those boundaries or holding the line even. So these are some other pictures that I took from these years of field work. Our future is fossil free on the left, and the protest of rearranging the letters of the stickers to say no false solutions on the right. And yeah, there's one overarching goal of my research and work in general is cracking coloniality, meaning finding, exposing, and further widening the cracks and fissures in coloniality's supposedly impenetrable wall. Thank you. Oh, there's another slide also with the thank you.
Thank you, Anna. Great to see your focus at that global level, the challenges at that global level. Okay, so let us now move
And I
into.
thought I was missing.
Let us now move into the questions and discussions. And in the order of presenters, I'd now like to focus on comments, questions, or feedback for Tareq. And sure, go ahead.
Go ahead. So you were talking about special training for parents. So let's say I'm a good parent. Anyways, that if I have an autistic child, the skill sets are completely different. And I assume those skill sets are easily taught.
Mhm.
Is that true?
Well, I mean, the training was mentioned there for the facilitators who are, for example, want to be like
not
the
the
peer to be
parents.
facilitator and support the other caregivers. Okay, that training was mentioned over there. But anyway, for example, just to answer your question, definitely, for example, there are certain programs right now here even in Canada for the caregivers to support their children in a different way, in a better way, for example. Like know how to be, for example, resilient and raising a kid, what other certain skills if they want, for example, to support their kids, if they have like special needs, for example, like verbal or nonverbal.
And this could change greatly depending on your cultural background.
Exactly. Yeah. So one article actually was really focusing on like South Asian community.
Yeah.
Okay, which shows, for example, a certain cultural responsiveness. Yeah. Which was really great. Talking in the same language, supporting the caregivers according to their beliefs, cultures, etc. Yeah, absolutely.
All right. Cool.
I have a question. You mentioned that around the socioeconomic divergence, and I wonder if you could expand on that. Are there more challenges than for those with lower incomes and access?
Yes, of course. There are 2 points I can clarify here. The first point, for example, that was published by Statistics Canada, that in low income families, autism is more prevalent. Okay, this is one point. The second point, that in one study showed that the participants, because like in a random study, they found that their participants were mainly from high socioeconomic status. Okay, which they raised like question, for example, are we supporting only those who have like the privilege, the wealth, the for example, the computers, etc., or we are supposed to support everybody? Yeah, everywhere. So that was like a finding of their participants, like ethnography and the socioeconomic status.
Yeah, no, that's fascinating, and it shows the imbalance. Where the
equity,
where the need is. Well,
exactly.
I mean, all the levels have a need, but if the need is, if it's more prevalent in the lower SES groups, then they're really missing out.
Absolutely, and there's extra burden for those like recent immigrants. Coming from different countries who don't speak like English very well. So how they are navigating. And I was participant, like a volunteer researcher in one of the studies with Dr. Farah as well as a principal investigator. And we found out that many recent immigrants, they are lost.
Yeah.
That there are certain support here in Canada for caregivers of children on the spectrum, but they were unable to reach that support because of the language, because of no guidance, because of each province that has its own guidelines and different support systems.
And maybe are physicians well connected to those community supports, or is that an issue as well?
There's an issue. That's why probably social prescribing can be a promising. We don't know. We want to figure it out. We want to study this. That's why we partnered with a community organization led by a physician.
Right.
Which is great. I mean, practicing physicians. It's not like they're backing around. No, he's a practicing physician, and they were really enthusiastic to go ahead and do that study. Yeah.
So is there also a lot of cultural acceptance? So if I'm in Canada, right, and I see a Black person, he could be from 100 different countries.
Yeah.
Different diets, different language, different cultures, different ways of saying things. So what you might assume, whereas if I'm from the Chinese community, during COVID, like we talked earlier, is that the Chinese community is actually very large. So it's very homogeneous, right? Whereas some of the smaller communities, if you're from Barbados, well, there's 2 people, right? You know what I mean? It's very hard to tie into be informed and get support, right?
Absolutely.
Yeah, okay. That's it.
All right, wonderful. So, for our next speaker, Joanne, yes. Any questions for Joanne? And I could just to follow up a little bit. So, Joanne, thank you for that really fascinating presentation. This work on Women's Political Empowerment Index is really interesting. And I noticed that some of your partners for the work, in your next steps of work, you're looking at how social accountability operates in rural health. Could you expand on that a little bit?
Yes, thank you, Dr. Turowitz. As part of my research, I am working alongside my supervisor, Professor Carrie Wu, to develop a strong partnership with the Rural Doctors Network in Australia and the Rural Coordination Center of British Columbia. And right now, our current project is a systematic review on the role of trust in health partnerships, particularly in in rural and remote contexts. So in 2000, the WHO was published a paper on Towards Unity for Health, and this Towards Unity for Health paper outlined a partnership model called the Pentagram Partnership. And within that model, it emphasized 5 stakeholder groups that were needed to make sure that service, research, and knowledge production was all related to health equity, and it was socially accountable. So those 5 partner stakeholder groups include policymaker, the community itself, of course, academics, health professionals, and health educators. So training the people who would train health professionals. And the idea is that we are looking at how that partnership pentagram plus actually was implemented. So we're going from theory, or rather the conceptualization of it in that paper, and kind of seeing how it was actually implemented in a lot of different projects. And it was primarily implemented in rural and remote contexts. So that's the key interest, and that's what we're looking at right now in the first analysis. The second analysis will be considering the role of trust, where trust is conceptualized differently based on stakeholder groups. For example, trust between community and other health partners will look differently from trust among researchers and between researchers and policymakers, for example. And the goal is to kind of understand why good health models or health equity frameworks are theoretically good, but not implemented in a way that leads to like socially accountable health system transformation. So what like the idea is kind of to go beyond the social determinants of health framework, like beyond that evidence of that to understand how the implementation of it, if that makes sense.
Right, how the implementation, the extent to which it's implemented, kind of thing.
Like how in theory how it's meant to be, but actually how it plays out within partnerships. Like to put it shortly.
Interesting. And looking at that world context in particular.
Yes.
That's interesting. It'll be interesting to see your findings. Sure. We don't see any other questions for Joanne. So Tunde, does anyone have questions for Tunde on his work on EMA? Yeah, please go ahead.
Yeah, okay. First of all, the resistance to antibiotics has been well known since I was in diapers, right?
Mm-hmm.
So it seems that there's really never been anything done about it, but there seems to be a lot of over-prescribing, which speeds up the process of resistance, right? Fair enough. And the other question I have is, I remember seeing a documentary on, they had worms that they got through the polluted water, and as the parasites grow, they break through the skin, right? So in your examples of all the things you were looking at, would that be included in there?
Okay. So maybe I'll start with the second question.
Yeah.
So yes, I'm going to be looking at antimicrobial resistance in general.
Right.
And so that's resistance to any antimicrobial agent, whether it's antifungal, antiviral, an antibiotic, or an antiparasitic. I think what you were describing sounds like dracunculiasis. Guinea worm, I think.
Yeah, guinea worm.
That sounds like, all right. All right. Yeah. So, yes, collectively, it's going to be one of the considerations.
Yeah.
But there is generally a lot more attention to resistance on antibiotics.
Right.
And you would find a lot more literature on resistance to antibiotics.
So the global community is prioritizing for you rather than you getting to make
working on what is out there. But I think there are also reasons for this.
Right.
Perhaps the burden of disease. Bacterial infections are quite common and tend to be more acute. So parasitic conditions are not necessarily as acute, and so will not necessarily be diagnosed or attention sought for them so soon.
It's often
and so yes. Okay. So it feeds back to what you were saying about antimicrobial use also.
Yeah.
So for parasites and for some of these other conditions, antimicrobials might not have been, now this is my speculation, might not have been, there might not be as much pressure on antiparasitics as there are on antibiotics.
Oh, okay.
Yeah.
And that makes sense.
Yeah. And then the first, I didn't get the question in it. I know there was a comment. Was there a question? The first.
Well, no, I would just.
Contribution. Yeah. All right. Thank you.
Right.
Wonderful. Well, we look forward to your research, Tunde.
Thank you.
And finally, Anna, maybe I could start with a question. So you have a legal background as well, which is really wonderful to be able to analyze at that global level. And I was just wondering, I really like the way you talk about the colonization of climate futures by the current generation. You know, young people have started to mobilize using legal measures, suing governments. And I wonder if you could comment on that. Do you see it as being an effective tool or anyways, just what are your insights having a legal background from that perspective?
Thank you, Professor, for the question. Yeah, it's really great to see the movement of and the articulation and global organization of youth. I think the main legal measure that has been very successful recently is the International Court of Justice's advisory opinion on climate change, which was a process that was started by Pacific youth, more specifically, Indigenous Pacific youth. And it has had this great legal standing that has basically given us by the ICJ, which is the advisory opinion. It's non-binding, but it talks about and it leaves no doubt that all UNFCCC climate agreements are binding. So the agreement, the main Paris goal to limit greenhouse gas emissions and global warming to well below 1.5 degrees Celsius in comparison to pre-industrial levels, that is binding. And we're already seeing science best available science say that we are already. Another tool that we can use as in advocacy or even nationally to hold our governments accountable to the agreements that they're making abroad, but they're not translating to national policy, to national climate policy. So the ICJ's advisory opinion is yet another tool that we can use. It's very recent still. It's from this July. So I think a lot of movements are still organizing and seeing how exactly is the best way to strategize with that and to employ that tool, but it's a very important one. And we're trying to also incorporate that in the UNFCCC advocacy work and negotiations. And when we pressure governments, we have that other set of tool to use. And say, this agreement is actually binding. You can't escape from it, because what happens is, and this year, one of the biggest, we had some wins in the negotiations this year. We have, because of efforts from civil society, just transition mechanism was agreed to be established, the Belém action mechanism that will bring just transition efforts from just being dialogues, which is what it has been for the past few years, to now, a global mechanism will be established for implementation of just transition efforts, which is very, very needed. But we also had some very heartbreaking losses, like for the better part of COP, it was looking like phasing out of fossil fuels was going to be in the final decision text. And in the very last 2 days, it was taken out of the text because of disagreements with the Global North, not wanting it to be in the text. So that was a huge disappointment. And these legal tools, like the ICJ's advisory opinion, are really empowering us and actually back down from this, because you've already agreed to this in COP28 in Dubai 2 years ago. In the GST, the global stocktake decision of phasing away. It wasn't phase out, it was phasing away, but still from fossil. Since then, countries like to pretend that it didn't happen, and they don't want any mention to that decision anywhere. But it was a binding decision and was already made, and it's there. And so these legal tools help us address that. But as I mentioned, law and the United Nations, they have their limits. They are also created within these systemic beliefs of progress, of development. It's not a coincidence that growth is always at the center of these decision texts. Countries are the only ones with voice and power to actually, write the text and reach consensus on what is being agreed. So, and most countries have an interest, economic or otherwise, to continue drilling and to continue fossil fuel exploration. There are very few countries who are now taking the lead to actually phase out and phase away. This year we had a huge example, a great example actually, of Colombia, who has been, even though they are very coal and oil dependent, as most of us in the global south are, and especially South America. Like my country, my current government claims to be progressive, but they cannot let go of oil, and they auctioned off many new oil exploration sites in the lead up to COP30 being in Belém, and these sites are all going to be in the Amazon, which is apocalyptical, and this is not even hyperbolic. It actually is terrible. But Colombia is really giving us hope. Petro, their president, not only has been issuing statements saying, we are dependent of oil, but this has to change. There's no other option. And because of the lack of commitment at this COP to agree to a phase out of fossil fuels, they have announced, alongside the fossil fuel non-proliferation treaty, which is also a legal tool that has been claimed and built by youth. It's an NGO, but the objective is to have a fossil fuel non-proliferation treaty. And Colombia has agreed to host the first conference for that treaty to be, to be something, to actually exist, and next year in April. So there is, it's slow steps to what is needed, but I think that's why it's so important that youth is heard and that youth voices are at the center, because like it or not, we're the ones that are gonna, and technically I'm still youth, even though I'm 30 to the UN, I'm still youth. Whether we like it or not, we're the ones that are gonna suffer the direst consequences. We're gonna be here to see, whatever it is that we inherit in this planet and from these crooked policies. So yeah, it's actually really hopeful to see what youth are up to, and that, people like to say that we are the future, that youth are the future, but we're actually already here and, doing progress and trying to move processes and make things happen. So thank you for that question.
Great. Thank you. That's really interesting. Any other questions for Anna or any of the speakers? Oh, yes, go ahead.
Yeah, I just arrived for your presentation, Anna, so thank you for it. I'm working with a team of researchers that are talking about climate change adaptation and maladaptation with a focus on health and well-being outcomes. So I'm interested in your framing of false solutions. And also it's really inspiring to see how integrated you are with your work and advocacy. I'm have a question about your methods and the interviews. Did you receive sort of pushback or resistance from kind of key high-level stakeholders at the UN? And with that, like when you're talking about tackling systemic and colonial roots of the crisis, how do you manage that, and how do you approach it in your interview questions?
Muted.
You're muted, Anna.
Sorry. About adaptation and false solutions. So false solutions is not an academic concept, right? It emerged from civil society and social movements, and climate justice movements more specifically. And it's more of a denouncing than a concept that has been developed. But what I gather from my research about false solutions is there's the obvious explanation, obviously, the solutions, that things that are presented as solutions, but that actually do not tackle the root causes of the climate crisis, that actually do not solve climate crisis, right? But what these activities or mechanisms or tools that are presented as false solutions or appointed as false solutions have in common is this: not being able to address the root causes, the systemic causes of the climate crisis, not reducing emissions, not contributing to reducing emissions, mitigation, which should be the main objective of the convention, as was agreed in 1992, but was since forgotten. And maintaining business as usual in the sense of giving other ways out or supposed ways out of the crisis without having to reduce emissions, without having to stop exploring fossil fuels, which should be at the center of any solution to the climate crisis. And they have some common consequences as well. One of them is that they promote further harm to frontline communities, indigenous peoples, and people that are most affected by the crisis. Like, for instance, nature-based solutions, offsets in general for carbon. They have like the RED Plus program. They have a extensively observed effect of displacing indigenous peoples. They employ this conservation paradigm on local communities and on indigenous peoples, that any human activity is incoherent with nature conservation. Therefore, you know, hunting in your territory, if you've signed a carbon offset agreement, is now forbidden. You cannot build any kind of lodging in your territory because you have agreed to this to be an offset in your modes of life. And so there are dire consequences. Monoculture of eucalyptus, for instance, is a very, very, very systemic and common offset activity that is seen, especially in my country of Brazil. Eucalyptus is not native to any biome that we have here. And yet, if you go into the countryside, you will see kilometers and kilometers of eucalyptus monoculture plantations that are done by corporations, by displacing local communities as well, and harming all of the native plants and species, because eucalyptus is a competitive species. It cannot coexist with other species nearby. And because it's not native to these lands, the effect is even more aggravating. It's even more harmful. And these plantations are actually being sold as a service for carbon offsetting, because you're planting trees, right? So you're offsetting, you're compensating for corporations or countries' emissions, and you can sell these rights to emit based on this activity that is actually very harmful. So these are false solutions, right? They are sold as solving the climate crisis, but you know, no one stopped
Gaming, sorry, they're gaming
emitting.
the system, right? So they're
Sorry?
gaming the system. You figure out
Yeah.
how to game the system. So
Exactly.
basically fraud.
If you talk about carbon removal technologies, carbon sequestration technologies, you can see in all of the major oil companies' websites, there will be something about net zero, which is basically like the global balance evens out to zero carbon. So you have to remove carbon so you can continue emitting, right? But you don't actually have to stop emitting, because that's why it's net zero in opposition to what social movements call real zero. And so they advocate for these carbon sequestration, carbon removal technologies that are not yet proven at a scalable level, and are also very harmful to ecosystems. And if you see who are the people that are the major investors in these up and coming technology startups for carbon sequestration, it's the same people who have been profiting from fossil fuel exploration all these decades. So you got it on the point. They have found a way to game the system, and that's it. So they, you know, even if they do eventually have to stop drilling and extracting fossil fuels, they are already building their safety net by investing in creating these technology startups that are already profiting, even though they have not yet started to provide the service that they claim to be able to provide. They have been, you know, traded out in these tech fairs and all of that consistently for decades already, and they haven't even been proven to work. So yeah, these are some of the things that have in common with false solutions. Usually another consequence is that the same people keep profiting off of the climate crisis.
And it reduces biodiversity, right? Like, which means that you're more dependent on corporations. So in the US, it's like chickens and cows and pigs, but they're controlled by 3 or 4 companies, right?
Yeah. And cows aren't even native to this continent, for instance. They were brought up by colonization as well. Yeah. And then because these legal systems operate in silos, they are all separated, right? The Rio conventions, the desertification convention, the biodiversity and the climate conventions kind of don't talk to each other, even though these things are all so correlated. Now, because biodiversity is also affected by the climate crisis and the mass extinction and by these false solutions, you're talking about biodiversity offsets. Which I don't even understand yet because it's not my area of study, but it's even more scary, I think. How are you compensating biodiversity, loss? So yeah, sorry, you talk a lot. There was another question about interviewing high-level officials and getting pushback. So one thing I try to do is I have to navigate the ethics of revealing what my research is about beforehand, but also not revealing too much so I don't bias the interviewee, because what my interviews have been mostly about are gathering different accounts of futures that are present. So I think in that sense, there's less pushback because I'm not bringing an approach or a position. I just want to collect and understand how people are coming into it, how people who are navigating these negotiations at different positions see the future, what kind of imaginary they have behind their worldviews, their lives, and what they're bringing to this arena of future disputes. So I think in that sense, there's less pushback. I ask mostly about what they see when they hear the word future, what kinds of futures they fear, what kind of futures they hope for, what motivates them to continue doing the work that they do at the UNFCCC, what kind of work they do, how did they end up there, how do they engage in the negotiations, these kinds of things. So I think in that sense, it shields me a little bit from getting pushback. Maybe when they read the research, there will be more. But yeah, for now, it's been okay because of that.
Just so I understand, you're sort of not misleading people, but you're hiding your true agenda, because one is you get pushback, but also they'll bias their answer. You're trying to prevent them biasing their answer at the same time as preventing pushback.
I avoid words that are going to get people to come in with a preset view, like colonization, colonialism, capitalism. I don't bring these things up when I'm explaining, but I'm not hiding my agenda. My agenda really is to know and map the narratives of climate futures that exist in the UNFCCC and how these different people see the future, what kind of future that they're hoping to build there, because people's dreams are other people's nightmares, and that in that sense that also plays with what kind of imaginary that they have for the future.
That's really fascinating. Yes, I think we could go on a long time. So thank you, and we look forward to when you finally write up and publish your findings.
Thank you. No pressure.
It's a journey. We're all on it. So yeah.
Okay. That's a good soundbite. People's dreams are other people's nightmares. Yeah. I'm going to steal it.
It is a great expression. It's the kind of world we live in, unfortunately. So, all right. Well, thank you so much, everyone, for both the presenters and the participants for engaging. Look forward to the development of your research projects. And I'd also like to remind everyone of the graduate scholarships are currently accepting applications and will be until January 16th. And if you look on our website, you can take a look at what the eligibility criteria are. And thank you, members of the audience, for joining us today. And please continue to monitor our website and our newsletter. And so thank you so much. The symposium is now closed.